Hello guys, this is Dr. Ajinkya here. So guys, I'm going to open a series of videos where I'm going to be talking about in detail about the different branches of the different anatomical regions of the ICA, that's the internal carotid artery. Now recently I uploaded a video where I've spoken a lot about the meningohypophyseal trunk, which is a main trunk of the cavernous part of the internal carotid artery, that's the ICA. Similarly, today in this video, I'll be talking about the infero-lateral trunk as well, which is also from the same part of the cavernous system of the ICA. So guys, what I'm going to do here is that I'm trying to teach you guys detailed anatomy of the internal carotid artery, its different regions, its different anatomical branches. So we all know that the internal carotid artery has got 7 different regions, for which I had made a video in previous uploads, a complete video on the anatomy of the internal carotid artery as well. So I'll put the link of that video in the comment section below. I hope you guys check it out. So in that video, I completed the entire anatomy of the artery, but in today's video, the series of videos I'm going to be starting right now, previously I made a video of the meningohypophyseal trunk. Today I'll be making a video on the infero-lateral trunk from the cavernous part. Next video I'll be talking a lot about the ophthalmic segment, that's the C6 segment of the ICA, which is going to include 2 main arteries, and that is going to be the ophthalmic artery and the famous superior hypophyseal artery as well. So I talked about already the inferior hypophyseal artery, dorsal meningeal artery, and the Bernasconi-Casinari artery as well, that's the Italian artery, in my previous lecture. So today I'll be talking a lot about the infero-lateral trunk, and next video, as I said, the ophthalmic artery and the superior hypophyseal artery, and the next one to that I'll be talking about the actual intracranial compartment of the ICA. That's going to include the termination of the ICA into the anterior and the middle cerebral artery as well. So I hope you guys enjoy the series for the anatomy of the ICA I'm going to make for you guys, and I hope you do like them. And if you do like them, please leave a like behind and try to subscribe to my channel. And let's begin with today's lecture. So to understand the basic anatomy of the infero-lateral trunk in a very clear way, we need to understand the anatomy of the cavernous part of the internal carotid artery. Now what you can see on the screen right here is the basic course of the cavernous carotid. Now there's a lot of confusion between where exactly is the parasellar and where exactly is the paraclival part of the carotid artery. Now, the cavernous carotid is a different part and the paraclival carotid is a different part. Now, as you can see over here, this bony part is called as the clivus. That's the posterior inferior part of the sphenoid wall. And this, what you can see over here, is the pituitary gland in the center midline. So we all know that the petrous part of the ICA, it travels as a short vertical and a long horizontal segment in the petrous part of temporal bone, and it exits via an area above the foramen lacerum over here, which is medial to the median nerve and above the area of foramen lacerum into the sphenoid floor, and thus enters the lateral wall of the sphenoid, right? So we all know that the ascending segment here, which you can see, is the paraclival segment, and above is the entire parasellar. Now, the exact location would be, you can see over here, this region. This is a region of the inferior intercavernous sinus, and the lower margin of this intercavernous sinus will mark the beginning of the short ascending segment of the parasellar cavernous sinus, and the area entirely below this will be the paraclival carotid artery. So this is the paraclival, and this area above this inferior margin of the intercavernous sinus will be the short ascending parasellar artery. Okay, now at the level of the inferior margin of the pituitary gland, which you can see over here, it takes a short turn and moves laterally and anteriorly. So this becomes posterior to the anterior aspect, and thus it is called as the posterior genu. Genu is nothing but a bend of the artery, so this is called as the genu. So that's the posterior genu, and we have a large a long horizontal segment which eventually terminates into the anterior genu, and what we can have over here is the clinoidal part and then the supraclinoidal part above that. So this is the basic anatomy of the cavernous part of the internal carotid artery. Now, to understand the infero-lateral trunk, we need to move ahead. Now, this is a very rather confusing photograph which you may not understand very clearly, so I have one more for this. So if you can have a close look at this photograph of the cadaveric dissection, this is a pituitary gland right here. So this becomes the right side cavernous sinus. This becomes the right ICA, right cavernous sinus. Now this is a cavernous sinus. That's the lateral wall of it. That's the medial wall of it. And that's the content of the cavernous sinus. And in the center, you can see the infero-lateral trunk. Now, there are very few points which you need to know about the anatomy of the infero-lateral trunk, which is, now, the very first point is that the infero-lateral trunk will be present in the inferior and lateral aspect of the cavernous sinus. Hence, the name is infero-lateral trunk. But, very important, second point, you have to remember that it is always going to be above the sixth cranial nerve. That's the abducens nerve, as you can see over here in this cadaver example. So this is a trunk which you can see over here, which is always above the abducens nerve and arises from infero-lateral area of the cavernous sinus. Okay, so these are 2 points. The third point, you have to always remember that in comparison to the meningohypophyseal trunk, now what you can see over here on the screen, you can see the labeling, which is the inferior hypophyseal artery. In my previous video, which I have told you about already, about the meningohypophyseal trunk, there were 3 branches from the trunk. So the inferior hypophyseal artery is the one which supplies the pituitary gland, mostly the posterior lobe, and if the anterior lobe, the periphery of it. Okay, so that's the inferior hypophyseal artery. That's the meningohypophyseal trunk. If you can notice very carefully, it is also superior to the meningohypophyseal trunk. Though the name is infero-lateral trunk, it is always superior to the meningohypophyseal trunk and the abducens nerve. Now, to be precise, the distance between the meningohypophyseal trunk and the infero-lateral trunk is roughly on an average about 3 to 13 mm in distance. Okay, so this is, you always have to remember. So that's the third point. Now, the fourth point is that the infero-lateral trunk will always arise or originate from the central portion of the posterior surface or the inferior surface of the horizontal ICA. Now, if I can show you this photograph again, this was the horizontal segment, okay, right over here, and somewhere around here will be the meningohypophyseal trunk. If I lateralize the artery, I will be able to see the meningohypophyseal trunk very clearly. But the infero-lateral trunk will be here somewhere nearby, above. You can see this is the abducens nerve, will be above the abducens nerve. That's the horizontal portion. This will be the central portion of it. So somewhere around inferiorly here or on the posterior surface, the infero-lateral trunk will originate. So this is a fourth point you need to remember always. Okay, so these are the very 4 points you need to remember for a skull-base surgeon and a neurosurgeon as well. Now, the fifth point is that it's very common. You can see, if I can zoom this for you guys, you can very clearly see that the infero-lateral trunk is dividing into 2 main branches over here. One which you can see is going posterior and superiorly. It is quite evident. One is going quite posteriorly and superiorly, which is called as the posterior superior branch, and the one which is quite frankly going anteriorly and inferiorly, this branch is called as the superior orbital fissure branch. And there are 2 more terminal branches which I'll talk about in some time. So always remember, the fifth point is that this trunk will divide into 2 branches, the posterior superior branch and the inferior anterior, which is the superior orbital fissure branch. Now, the branching will also always take place above the level of the abducens nerve, okay, as you can see. And yeah, so the first thing is the posterior superior branch, which is the first branch, which is going posterior and superiorly. Now, the posterior limit is up to the tentorium, the dura of the tentorium. That's the posterior limit up to which it can go. And basically, it is around the lateral wall as well. So it supplies the third, fourth, and the first division of the trigeminal nerve. So that's the supply of the posterior superior branch, as you can see. So if you want to remember this theoretically, I can show you one more photograph of that so you can have both an audio and a visual representation of it. So I have the same photograph right here for you guys, and you can see the theory for this. So if you can read this, the infero-lateral trunk divides where the sympathetic fibers arising from the ICA join the sixth cranial nerve. So that's one more important point, the sixth point, as in where exactly the infero-lateral trunk divides into two. Okay, so also it has got a proximal superior branch, which I showed you right here, which runs posteriorly along the inferior aspect of the trochlear nerve. Now, that's the lateral wall. Now it will follow the inferior margin of the trochlear nerve right up to the tentorium behind, okay? And it's a posterior superior branch, and it will always follow the trochlear nerve inferiorly, okay? And supplies the proximal portions of the third, the fourth, and the V1 as well, okay, as I said some time back. So the second branch, as I said, is the anterior inferior one. That's called as the superior orbital fissure branch, which courses in the apex of the anterior medial triangle of the cavernous sinus. Now the cavernous sinus is typical quadrilateral in shape, and it has got a few triangles within. So this is the anterior medial triangle, and you can see this is the one which is traveling through this anterior medial triangle in the cavernous sinus. So this, actually, you have to remember, now we can see this is a bulge of the V2, I suppose, and that's the bulge of the V1, and that would be the area of the fourth cranial nerve somewhere around, and the above one would be third cranial nerve. So this the superior orbital fissure branch will travel always between the first two trigeminal nerves, that's the V1 and the V2. From this point, it branches, and the main portion continue towards the superior orbital fissure, entering it, providing along its course small feeders to distal portion of the third, fourth, sixth, and the V1 cranial nerves. So both of these branches are going to supply the third, fourth, and the V1, and in this case, the sixth cranial nerve as well. So you also have to remember, in my previous lecture, I have told you that the proximal portion of the abducens nerve is also supplied by the dorsal meningeal artery, also called as a dorsal clival artery of the meningohypophyseal trunk. So also in the infero-lateral trunk supplies the abducens nerve as well. So now, as I said, there are two terminal branches. These are nothing but the two terminal branches, one being the foramen rotundum artery and the other one being the foramen ovale artery, which respectively supply the maxillary nerve and the mandibular nerve as well. So this is all about the infero-lateral trunk. This is nothing but a visual representation of the lateral wall of the cavernous sinus right here. This being the internal carotid artery, that being the abducens nerve right here. And these are nothing but the third, the fourth, V1 and the V2 cranial nerves, and the branches of the infero-lateral trunk representation shown over here. So this is about the basic anatomy of the infero-lateral trunk, with its two terminal branches and two main branches from the main trunk. So this is about the infero-lateral trunk, but always remember that there's one more really important point. Now, as I showed you the anatomy of the cavernous carotid, now we know that the cavernous carotid has got only two main trunks, that's the ILT and the MHT, but there are certain variations in the human anatomy that sometimes you will find branches from different carotid branches into horizontal parts of the cavernous carotid. So the first one, which I'll be explaining here to you, is the McConnell's capsular artery. Now the word is really important. The artery is, again, I call it McConnell's capsular artery. Now this capsular artery is not always present, but it is present in about 50% of the human population, and when it is present, it will always be around the superior most aspect of the cavernous carotid. as you can see, this is a superior most area of the cavernous carotid. So normally this McConnell's capsular artery will arise from this region, but sometimes in less than 10% of individuals it will arise from the somewhere around the posterior inferior surface of the horizontal cavernous carotid. So that's the McConnell's capsular artery. It supplies the periphery of the anterior lobe of the pituitary gland, and it may also sometimes pierce the sella turcica and enter the sphenoid through the craniopharyngeal canal, also called as the Sternberg's canal, which we commonly see in cases of CSF leak, in case of lateral recess CSF leaks. Okay, the second branch is the persistent trigeminal artery. Now, this is really important for ENT residents, skull-based surgeons, for fellowship examinations, and neurosurgeons as well, because if at all you are operating on a patient and this persistent trigeminal artery you encounter, it is kind of in close relation to the abducens nerve. So it is present in almost like 0.06 to 0.6% of population. Now, normally, this is a posterior gaining of the cavernous carotid, right? Now, normally this will be arising from the middle portion of the posterior gaining. So this would be the exact area where this persistent trigeminal artery, in case of 0.06 to 0.6% individuals, will arise. So also, depending upon the anatomy and the course of the abducens nerve, this persistent trigeminal artery is having two different courses. So if it arises posterior lateral surface to the horizontal cavernous carotid, it will be lateral and inferior to the abducens nerve. So this is the horizontal cavernous, this is the abducens nerve. So it will be inferior and lateral to the abducens nerve, which you can see right here. In that case, the abducens nerve, if the artery is present here somewhere, the abducens nerve will be shifted upwards. And similarly, if the artery arises from the posterior medial surface of this horizontal segment, it will be lying medial to the abducens nerve, and such is the case. So this is a case where you can encounter the persistent trigeminal artery. Okay, so that is really important, you need to know. And sometimes it may penetrate the sella turcica through and through and join the basilar artery, and sometimes it may pass lateral to sella turcica, moving lateral to it. So this is all the variations which you can see in the persistent trigeminal artery around here. Now, because the trigeminal artery is very close, because you can see the trigeminal ganglion, Gazarian ganglion nearby over this region. So this is all in close proximity around this place. The third artery will be the ophthalmic artery. Now, we all know in my previous lecture on the carotid artery anatomy, I have spoken about the true anatomy as. Now, normally the ophthalmic artery will arise from the C6 segment along with the superior hypophyseal artery. But as you can see over here in this cadaveric photograph, this is the cavernous carotid. This is a cavernous paracellular carotid, and it is arising. This is the ophthalmic artery. That's the OA. That's the ophthalmic artery superior to the abducens nerve right here. This is actually arising from the cavernous part of the carotid artery, which is like really rare, only which you can see in case of 1 to 7.5% of human population. That is like really low. Most of the cases we have it from C6, that's the ophthalmic segment, which is the supraclinoidal segment of the intradural segment. But in some cases, we can see the ophthalmic artery arising from the cavernous part of the carotid artery. So these are the three variations. The fourth and the fifth variation are also important. The fourth variation is the recurrent artery of the foramen lacerum, which may supply the pericarotid autonomic nervous plexus. It forms an anastomosis with the ascending pharyngeal artery. Okay, the fifth one is the branch of the artery of the Gazarian ganglion. Now, as I sometimes showed you sometime back, I showed you this Gazarian ganglion somewhere nearby. This is a trigeminal ganglion called as a Gazarian ganglion. Okay, so this is the Gazarian ganglion being supplied by the branches of the artery of the trigeminal artery. These branches cross the abducens nerve. You can see the abducens nerve over here within the cavernous sinus as they travel laterally. So these are the 5 variations of different anatomical parts which can arise from the cavernous segment of the ICA. So I think this is all about the infero-lateral trunk of the cavernous carotid. So I've completed so far the meningohypophyseal trunk and the infero-lateral trunk. In my next lecture, as promised, I'll be talking about the superior hypophyseal and the ophthalmic artery, and then I'll be talking about the anterior cerebral artery and the middle cerebral artery for all the neurosurgeons out there and the skull base surgeons out there. So I'll take your leave, guys. Till then, you take good care of yourselves, and see you in the next video. Till then, take care.